Good morning, everybody, and welcome to my show. I'm Dr. Niru Prasad with my background in pediatrics and emergency medicine, affiliated with Henry Ford Health System, St. Joe, Oakland, and Beaumont. The theme of our health talk today is mental health issues among adolescent adults post-COVID. Joining us today as our guest speaker is Dr. Chris Sherve, with a mental health specialist. And Chris and I, we have been friends for over I don't know how many years, and we have always talked about so many issues that is going on with our children, adults. Also during the COVID era, we produced several videos there. But today he's going to talk about the post-COVID 3 years later. So good morning, Chris. I know you have such a nice introduction, but could you give it to them, our viewers, again?
Certainly. Good morning. My name is Dr. Chris Allen Sherve, and I have a PhD in mental health counseling, currently in private practice and working with folks with trauma, mental health issues, substance abuse, and a variety of things. And so this is probably our 15th to 20th show we've done.
Yes,
and,
we produced.
Today's show is going to really be kind of piggybacking off one of the shows we did about 3 years ago, over 3 years ago, when we talked about COVID-19 before anyone else had ever talked about COVID-19.
That is true. We were the first one.
Yeah, we were actually the first show. I don't know how many people saw that show, but we actually beat the national news that day. So that night is when I think the national news started talking about COVID-19, but we did our show that morning.
Exactly.
So we were already on the point with this disease. So this show today is really talking about what we've learned 3 years later from the effects of COVID-19, how it's affected mental health among adults and adolescents.
Okay. So that's true, yeah. So I believe you have brought some wonderful slides. So
yes.
Can we get started with
Absolutely.
the slide?
Absolutely. Well, one thing we've learned since 2020, COVID-19, is that roughly 22.8% of people have had a serious mental health problem. And that roughly represents about 60 million people. Of that population, about 6% have had a serious mental health problem, and that represents about 14 million Americans. We look at the youth 6 to 17, and we see that 16% or so have had a mental health disorder, and roughly 7 to 8% of Americans have had co-occurring disorders, which means substance abuse and mental health. So we see that some of these, the incidence of mental health has definitely increased post-COVID-19.
Exactly.
Yeah. So we can have the next slide. We can see some other relevant facts to the mental health issues, that about 47% of U.S. adults who had a mental health problem received treatment in 2021. Now, what's interesting about this fact is that over half of people didn't get help. So, of that 47% of people who got help, 52% didn't get help, and that's very alarming. And we also see that number with serious mental illness. About 2/3 of people only got help for their diagnosed mental problem. So that means roughly 1/3 of the population never got help for this. We also see that youth, about 50% of youth between ages 6 and 17, never received treatment either. So we're doing the diagnostic work. Kids and adults are getting assessed, but only half or so are getting help for it. And so we also know, this is a big factor that I think is very important, that once a person has been diagnosed with a mental health problem, it takes about 11 years on average to get help.
Is that so?
Yeah.
11 years.
11
That's
years.
a long,
So could you imagine having an untreated mental health issue like depression or anxiety and how it impacts on your life?
And their mortality.
Yeah, and you don't get help for it for a decade later.
Is true.
And just imagine the toll that it's taken on your life and your family in the course of that time that you haven't sought treatment. And I think also what we've learned is that a lot of the population who have mental health do not have adequate health insurance coverage to pay for their treatment.
Right.
And that's a big gap in our system as well.
Yeah.
And I think another factor that's really important, and I see this in my practice, with telemedicine, we're able to service people in areas that don't have they don't have access to mental health facilities or treatment.
Right.
So the telemedicine model has really helped to deal with the areas that are very impoverished related to therapy. And that's roughly 160 million people in America are in these areas that have low numbers of therapists or agencies to provide mental health services.
Not the urban area, the rural area.
The rural
you're talking
areas,
about,
yes.
right?
Yeah, I have patients in upper parts of Michigan that the nearest therapy agency is 50 miles away.
Oh, okay.
And I mean, they're literally in the middle of nowhere. And we're able to do, therapy through the phones and laptops and so forth. So that's really been a good addition to helping to deal with the mental health problem. Absolutely.
Yeah.
Can we have the next slide? So this is just a racial breakdown of some of the mental health, what we've learned post-COVID-19. And these numbers have pretty much stayed consistent. But what we will notice that there has been a big increase in the male population seeking treatment.
Oh, okay.
And that's a good thing. And I am seeing that in my practice. Yeah, I am seeing one out of three calls to my office are for men.
Okay.
Men seeking therapy for themselves, not their wives or girlfriends calling. They're calling, which is a big deal. A lot of times you get the wives and the girlfriends calling for the husbands, but now I'm getting husbands and men calling for themselves, recognizing that they're suffering with their mental health. It gets back to that statistic of you find out you have a problem, but you don't get help until 10 years later.
Right.
And that's what we're finding, I think, with the male population is that men are starting to come in and getting help. And that's a big deal. Especially I see that in the African American community. I see a lot of African American men coming in for therapy. And that's a good thing.
And I see your last one, the gay or the bisexual, more in them?
Well,
55.6?
Yeah, that's a pretty high number. And that number suggests that within the gay, lesbian, bisexual, transgender community, that there may be some association with mental health that's higher than the average population. And that probably needs to be further investigated and studied to see what are some of the risk factors associated with the gay, lesbian, transgender, LGBTQ community to see what might be some risk factors associated with the population.
With them,
We've also seen the other numbers stay pretty consistent over the last 3 years. Okay? And we can have the next slide. So we also saw some impacts on personal and family dynamics related to mental health and the effects that COVID has had on families. And we see that roughly people who have depression, 40% have a higher risk of cardiovascular disease and other type of metabolic problems. And I'm sure that you see that in your practice.
Underlying physical condition like diabetes, high blood pressure, those kind of things.
Absolutely.
Yeah,
and that's a big number when you consider 40% could be at risk for other secondary problems, which could also be very life-threatening as well. Also, we see that there's a high correlation with mental illness and substance abuse. Yeah. Roughly 35% of the population have this co-occurring issue, which makes it more complicated for practitioners like myself to treat these folks because you not only have mental health, but you also have substance abuse. And they do need to be treated very differently sometimes. And so that could be another problem for practitioners to help treat both of those types of issues. And then we also see that some of the other statistics are, people who have mental health issues typically have higher unemployment rates. They have difficulty in finding employment. I think there's probably some discrimination and stigma associated with folks who have mental health issues. We just saw that Circuit Court Judge Bernstein, he admitted that he had a mental health issue, and he decided to go get some help.
Finally, he admitted.
Yeah, and that's a good thing to be able to be public and to acknowledge your mental health issues and not feel that your masculinity or your credibility or your character or your career is in jeopardy because you identify that you have a mental health problem. So that was a great move, and I appreciate that. We also see that students with mental health issues are more likely to repeat a grade.
Right.
Yeah, so we can see that these things can affect academic performance. A lot of kids who have mental health challenges, especially anxiety, which is a big uptick since COVID-19, A lot of kids are not making it to school. I have a new patient I met yesterday. Primary reason, he's not going to school.
Oh,
and it's an anxiety. Well, he's in the Grosse Pointe school system and high achieving environment, but he's having some social issues and mental health problems that are being flared up.
Exactly.
And so he's having stomach aches and all kind of problems in the morning, so he's not making it to school. Yeah,
somatic issues.
A lot of somatic issues.
Somatic
so we find that kids and adolescents who have mental health issues tend to have issues with school. They don't go, they're not focused, they're not engaging in their academic studies, and that can certainly be reflective in their GPA. Yeah, which can create more stress.
Right.
When you see that GPA drop and the parents start to get a little amped up about it, then that just kind of creates another. Then
they are alarmed.
Absolutely, and then it kind of caves in on them as well.
Yeah,
so,
right.
And so we also know that roughly 8.5 million people are caregivers to people who have mental health issues, and that's a big deal. I have one of my best friends. He's passed. He died at we were born a month apart, and he was a primary caregiver for his father.
Oh, okay.
And his father passed at 95. My friend passed at 48.
Oh, really?
And he primarily passed because of the stress associated with caregiving. And so that's a big thing that we've noticed now, that caregivers are really under a lot of stress taking care of family members and loved ones who have mental health problems. So that's a big thing that we also need to provide support services for the caregivers. And I don't think we think a lot about caregivers in this discussion.
No.
Right, because they're very important to, maintain that person's life. Sometimes the caregiver is the one that's there when the therapists and the doctors aren't. So that's very important. If we could have the next slide. We also see some impacts on community. And I'm very concerned, I've always been concerned with the homeless population.
Right.
And we know that since the deinstitutionalization of the mental health system, that most of the mental health hospitals, especially here in Michigan, have been dissolved. And so a lot of those patients who were in these hospital facilities have been put in community-based programs. But unfortunately, if you look at the demographics, a lot of those patients that started in primary mental health hospitals were then infiltrated into the community-based systems, ended up in jails and prison. And so that's what happened. And a lot of that was because they became homeless. And, because the nature of mental illness with some folks is that they don't like people. They like staying away from people.
Right.
So they don't seek services, so they end up being homeless, and then that can result to being incarcerated. So that's one impact that we've seen. And we also see the other statistics related to depression and anxiety. It affects mortality and birth rates. And that's very important. And we also see that roughly 600,000 people annually are hospitalized for major psychiatric disorders on a regular basis.
Isn't it? Yeah.
And the problem with that is that we don't have nearly enough hospital beds to provide the services for people who need these services. It's really kind of sad. And I think COVID really shed light on how deficient our mental health and our medical systems were dealing with something like a pandemic. Yes. So we also know that the military folks have been affected. I've had many soldiers and veterans coming in for services, and we see roughly 20% of our U.S. veterans have had a diagnosable mental health problem. And so fortunately, the VA is servicing a lot of those patients, but they're also out in the community and receiving services as well. So we could just see that since COVID-19, a lot of populations, a lot of folks have been affected in dramatic ways.
Did a lot of harm. The little COVID, corona.
Well, one little virus that you can't see changed our entire world.
I know,
and it's changed the mindset of people. And I think that, part of this show today is talking about the effects it has had on people.
Exactly.
Yeah, and I've seen just in my practice alone, a lot of people are coming in because of COVID-related mental health problems.
Yeah, right.
Isolation. Re-engaging back into their lives. We've been home, working at home, I think so long that our brains have readjusted to sort of a new normal of working at home. And I think a lot of people are really struggling with motivation, energy. I know you just did a show earlier today on sleep. And I have a number of patients who are reporting sleep problems, fatigue, energy issues, motivation problems. And I see these all directly related to the effects of COVID and the mental health, because a lot of folks are really stressed. I think COVID virtually...
Economic pressure is a lot too, unemployment.
That has been devastating. I've had a number of patients who have been wiped out financially due to either unemployment, having to take money out of their investment portfolios, like their 401ks.
Which is down anyway.
And everything is down, so that makes it even more stressful, especially if you borrow against your 401ks with these high interest rates.
High interest.
So a lot of patients have had catastrophic medical bills. I have a patient now who is struggling with uncontrollable hypertension because of the effects that COVID had on his lungs. And he's been off work for about 9 months now. And so he's seeing me for mental health because it triggered a lot of depression, a lot of anxiety. He's the breadwinner in his family, and he's not been working in 9 months. And he almost died of COVID, not to mention that fact. So now he's recovering, and now he's trying to get back healthy and to work on his mental health and his physical health. And so I'm seeing a lot of patients coming into the practice with this type of dynamic, trying to recover financially, emotionally, physically, and mentally from the effects of what's happened to us in the last 3+ years.
So, Chris, yesterday I was just kind of collecting my thoughts, reviewed my previous videos, and one time we had talked about this smoking, with the lungs disorder, right? That the e-cigarette.
Yes, the vaping.
Are you still seeing them more of this in your clinical practice?
Well, I think that's probably a show by itself too, and we did talk about that.
I know we talked about it.
I think what I'm seeing is that
lungs disorder with the mental illness. That's what I mean.
I have 2 patients right now. One that came in yesterday, and a patient I've been working with for about 6 months, and they are primarily using vape cartridges, both for nicotine and for THC. And we're starting to see a medical phenomenon occurring where some patients are having extreme gastrointestinal disorders.
That's what I was going to ask you about, because there seems like they have hyperacidity and
there's something in the vape chemicals that apparently for some people creates a very high level of stomach irritation. In fact, I have a patient, if he smokes, he gets hospitalized because he gets so sick. He's been to the hospital about 15 times because of trying to figure out what was going on, and I've really narrowed it down to his using of the vape cartridges. And so he stopped using those, and that's helped to reduce the stomach problem. So I think as a culture, we're seeing those cartridges being used more widely because, like he said, my patient said to me, they're more convenient. They're private. You can go anywhere and smoke, and it doesn't create the odor. And so a lot of people are using them at work and driving and concerts, and so it's becoming part of our culture. Now, is it healthy? I don't think we know yet. I think, that's kind of like in your area. But I think from my understanding of the chemicals that are involved in these cartridges and whatnot, I think long term we're going to start seeing some problems.
What I was reading, Chris, is that there's some metal component and it causes like a alveolar fibrosis, pulmonary fibrosis, in a gradual, not sudden.
Yes,
and they have more asthmatic attacks.
Absolutely, and I think times like this, where the allergy season is flaring up, people that have that are going to have a bigger problem.
Now, long-term sequelae of vaping. That's what I was very interesting.
I do think, though, they probably have cleaned up those devices, because I know when we first talked about it, our show was about the contaminants that were in there that were causing people to die. So I think they've cleaned that part of it up, and the vape cartridges are much safer. But the question really is vaping safe? And I personally, I don't know. I don't really know. I think, if you compare that to tobacco smoke, then maybe.
To the vaping.
But I'm not so sure. I think long-term studies are being conducted now. And I think vaping has been around now maybe about 5 to 7 years. So I think we'll start to see some long-term data come in that might give us an idea of what effects it's having on lung tissues and that kind of thing.
What do you think? What is your advice about the high schoolers who started doing this vaping, since they were in the middle school and all that? Now they are high schoolers going to the college. Will there be a lot of after effect of this when they go to college, like sequelae like asthma?
I think we can predict that safely. I think we're going to see an increase. Yeah, absolutely. Because what happens when you're smoking and vaping, you're not really exercising.
Right.
You're not athletic. A lot of kids, when we were coming up, we played basketball, football, baseball. Sure. And, we didn't have Xbox and PlayStation. And so we lived a more active life as kids.
Right.
The kids nowadays are more sedentary. They sit around. I don't want to stereotype, but, a lot of kids are gaming a lot, spending a lot of time. They're not exercising, pick up sports like we naturally do. And so if you're adding vaping and THC, you're not likely to exercise, so you may be getting out of shape, and so you might see those effects.
Exactly.
I do think, though, what I am seeing that I am very concerned about is the high level of addiction to these devices.
Yeah, addiction is a big, major issue.
Yeah. I mean, cannabis historically is in America was used as a demonized drug, but around the world it was always considered a medicine.
Right.
But there is an addictive component to cannabis and all drugs, and I think that while there are some health effects that are very positive for using cannabis responsibly, I do see a number of patients who are using the vape cartridges, the more crystallized forms of THC, are so addicted. And those vape cartridges, especially the nicotine ones, they create a high level of anxiety just if that thing goes missing for 30 seconds. So, if people, misplace that little cartridge, they start freaking out,
Exactly.
And I mean, really, and it's like, wow,
Oh my God.
And that's something different. I mean, I know people have nicotine cravings and things of that sort, but these devices seem to create a lot of anxiety when they don't have it in their hand. It's like a new pacifier.
Yeah.
So I'm concerned about how the addictive levels are, and people trying to get off of smoking using these devices. I'm not so sure if these devices are helping.
So we don't even have time to talk about the addiction part, but fentanyl related death is climbing up and up in all the time.
Well, they're putting fentanyl literally in everything that people can use. I have heard they are sprinkling fentanyl powder in marijuana, which is to me is ludicrous. Because I don't even think you can even be effective that way.
In our country, they are doing a lot, in the urban areas.
Yes.
Urban and the villages too, because they don't have enough money, so they just do the mix.
Yes. And I mean, it's becoming very scary out there.
Very fentanyl,
So this show, like I said, just was an update really of what we've learned. We've been tracking COVID-19 for 3+ years.
Yeah, right.
So these are just some of the latest numbers that we're starting to see now, post-COVID, and how it's affected people's mental health. And I can tell you, it has changed our whole world. We're not the same people coming out of COVID that we were going into COVID.
No,
we're much more stressed, much more anxious, irritable, aggressive, mean, nasty, as well as having depression, anxiety as major problems.
You said it, Chris. You said it.
Well, you see it when you drive on the street. People are just very different now.
Yeah. 193 plus 0.2 billions in lost earning each year.
Yeah, that's the toll. We're starting to see it adding up.
Our economy and the war, everything else contributes, right?
So we need to really focus on our mental health right now because we're going through a tough time.
But they have been they're giving a lot of money to the mental health.
Yes.
Everywhere, whether it is children, adults.
But
still there are much more.
Well, we still know, now we got to wrap it up, but there's still access to treatment. We saw that only a third to a half of people who are diagnosed are getting help. So we still have a big gap in providing help for the
Right,
other
yeah.
50% of people who have problems who are not getting help.
Yeah.
So that the war continues, right?
Right, yes, yes.
We continue to fight.
So this is, so what is your final advice, 1 minute to our community?
Well, I know right
while
now we're
wrap up?
all coming out of this. We need to really focus on ourselves. We
Yeah.
need to really work on our mental health. We need to focus on exercise, nutrition, diet,
Yeah.
and getting out there, wellness, mindfulness,
Mindfulness,
meditation,
that is
yoga,
big thing, yeah.
walking, bike riding. This is what we need to do to take care of ourselves.
Right.
Real simple, easy, no cost kind of
Yeah.
stuff. Yeah.
And try to stay away from the drugs as much as we
Yeah.
can.
And toxic
First,
people.
use your own.
Yeah.
Yeah.
Yeah. Stay away from all toxins. people, places, and things. Absolutely.
So I like to thank you, Chris, for coming to my show. Every time I have you, it is a pleasure because you add to my knowledge
Yeah, I appreciate
and
that.
everybody's knowledge. I like to thank our viewers for watching my show today, Mental Health Issues Among Adults and the Community Adults. So until I see you all, have a safe and a wonderful summer.